as I'm getting shoulder flexion. What happens, there's the inferior border right there, which is exactly where it should be in the axilla. So if I follow it around, there it is. There it is. Okay? So if I do that, what about the tone in the rhomboids? It's normal. Do I mobilize? No. Okay? Now, you're going to see this in some patients. Obviously, we can't reproduce it with Anthony, but what you may see is that as you get glenohumeral flexion to about 90 degrees, the inferior border of the scapula is already into the axilla. It's already moved over that far. What would we say about that? Is that okay? Low tone, decreased tone, because there's nothing holding the scapula. Do we mobilize?
No.
No. Okay. So now I'm going to be moving the shoulder joint, feeling the inferior border. I get to about here, and wow, it stops. It's not moving anymore. And it should be moving 2 degrees for glenohumeral, 1 degree for the scapula. It's not moving. It's stopped. What would that be an indication? So I need to mobilize. So where I'm going to start is exactly that point. So I'm going to move him, and when I feel the scapula doesn't move any further, that's where I'm going to start my mobilization. So I'm just going to support this arm. My hand is going to be on the medial vertebral border and my palm on the inferior angle. The movement that I'm going to do is the inferior border needs to come upward and outward, correct? And it needs to go in a circular motion. So am I going to be then bringing the scapula clockwise or counterclockwise? Clockwise. Okay. So my mobilization then, and I'm going to use my body, I'm going to put a little bit more pressure coming out. Rather than going in, I'm just going to let it kind of release going in. But it's going to be a circular movement. I'm not moving this. It's just coming along for the ride. And nice and slow. Avoid extending and putting traction on this arm. Nice and slow. Now, when I feel the inferior border of the scapula moving, what I can do is hold it and see how much more range then I can get into shoulder flexion. When I feel it stop, scapula is not moving anymore, then I start mobilizing.